programs. I'm really happy to be a part of the MaxxUP system and trying to help youngsters in a great way. So actually, I started my journey to become a doctor in 1997, and it was mainly because of my parents asked me to become a doctor because there was not a single doctor in our entire big family. So I started becoming a doctor, and I got an admission into a good college, and I got trained to be a doctor. But subsequently, during my career, what I saw when I went to field, when I went to the villages and the hospitals in and around the medical college, I saw that the problem is more in the community. And from that day, maybe after 6 years, when I was preparing for my post-graduation with one of my very close friends, I decided that I will go for public health. He said, "What? You thought you are going to be? I thought you were going to be an endocrinologist." Then I said, no. I think be what I am, my nature and my attitude and my aptitude. I always like mingling with people and managing, leading, and working for a cause. So that's what always motivates me. So, and that one morning, I decided that I would be a public health physician, and from that I started preparing for my post-graduation entrance examination, and hopefully and luckily I got admission into a good college, and then I did my post-graduation in community medicine. The degree is called somewhere it is called preventive and social medicine, somewhere they call social and preventive medicine, but right now almost it is uniform across all the colleges, and it is called community medicine. And in the Western world, it is known as public health, because public health is not only for the MBBS grads. Other people can go into public health. So it's more or less for anyone can go into public health. Unlike in India, a community medicine degree, only a person who has done his MBBS, he can apply for that. But public health is open for anyone actually. And from the day I joined public health, as you might be you must be aware about WHO UNICEF. We were the kids then, so it was our dream to work for UN organizations, not knowing what they actually do. But usually the highest aspiration of any public health person is to work for UN. That's the usual aspiration. And finally, after my long journey, now I am working for UNICEF. So let's see how it unfolds. I'll try to put it as simple as way as possible.
Yeah.
So as you can hear, there are two words. One is public and one is health. So
Right.
definitely it is not about an individual. It's about the public at large. So it's healthcare for the entire public. The public may be of a village, it may be of a block, it may be of a district, it may be of a state, it may be of a country, or it may be of the entire world. Suppose when COVID happened, we call it a pandemic because it spread across the world. There can be a small outbreak in a single village. That can be an epidemic with across maybe several villages or in a block or in a district. So the scale is actually it can be of the scale can be from a village to the entire world. And when you plan something, basically public health means planning and designing your countries, your states, your districts, your blocks, village health program, so that it caters to the holistic health need of the entire community, not just clinical care. For clinical care, they will go to either a quack or a trained medicine practitioner or a MBBS doctor, or they can go to corporate or private. But the as I said in the beginning, that the original name was preventive and social medicine. So basically, public health is more about preventive and promotive healthcare, so that the person they remain healthy, and if at all they fall in, they get better treatment so that they recover early, and when they recover early, they will be an asset to the country. So basically, the social aspect cannot be ignored, because public health is always connected to their demographic factors, the social factors, the economic factors, because affordability and accessibility all many times depends on all these factors which are not directly linked to healthcare. So in public health, it is more interesting because besides the clinical care, you have to be socially aware. You have to know all the recent advancements that because in every now and then you must be reading something that you eat something or you drink something or you do something, then you can prevent these things or you can cure these things. So with the now it is called infodemic. So in the era of infodemic, so to put it in a nutshell, public health is about healthcare of the entire public and designing the health programs, planning the health programs, implementing health programs, also monitoring and evaluation of the health programs so that they are on track. And so it's a holistic thing, it's a larger thing with a larger impact. So ultimately it will affect the individuals and it will help them in the long run. But sometimes the tangible outcomes may not be visible within a short span of time. It may take years to have the real impact. Suppose you want to decrease the infant mortality rate of a country. Infant means any child who is less than 1 year. So if you want to decrease that thing, so at input level, at output level, at outcome level, there are multiple interventions. And all these things may take years to have a real impact when the infant mortality rate of our country is actually decreased, is actually reduced. So it's not that simple, but it's very interesting. And as you asked, what are the scope of public health opportunities in India and the world? It has always been there. It will always be there. But actually, COVID has opened up a Pandora's box, and people are more aware about public health right now, because in 2005, a program was introduced, IDSP, Integrated Disease Surveillance Project. It was earlier a 5 years project, but they wanted to have a public health cadre. Just like in there are IAS, just like there are engineering cadre, so they want to have a public health cadre in the health system. But still, till now, it is not yet actualized in many of the states. Very few states have actually have a public health cadre. But COVID has actually made us understand that it's not only you have to do a clinical care, because you have to find out the pattern how the disease spreads, what are the different preventive things. All those the kids must be aware about all these mathematical models, how you predict that the course of the epidemic, and how can you intervene at the right time. So there is a lot of things going on besides just the clinical care of a patient who is having COVID and who is having a serious condition. Unfortunately, in India, in most of the committees by Government of India, either they have a cardiologist or they have a pulmonologist. Not undermining their clinical capability, but I don't have any idea about how strong they are in epidemiology of the disease. So this is the dilemma actually, but the system is actually accepting and the importance of public health. So the scope is huge, and I have visited and I have worked in multiple states. Started from Odisha, then I went to Haryana, then from Haryana to Uttar Pradesh, then Chhattisgarh, then now in Bihar. So the scope is huge actually, and bearing very few states like Tamil Nadu, Kerala, and all who are having a very good system. All the states, despite all the improvements, there have been significant improvements over the years, but still there are a lot of scope to work in India. And even for 1 or 2 decades the work will not be finished, because there are many states. The scope is wide, and in terms of economic viability and the perks for the job, that's also equally good. Based on your qualification and your experience, you will gradually climb up the ladder, and what's your basic qualification and your experience. And sometimes it all depends what is the analytical skills, how you present, how you advocate. So besides your technical knowledge, there are many other skills that would actually help you go up in these public health careers. So the scope is huge. To be in single line, the scope is huge, both for the public and for the individual who is practicing public health. Means that when after completing 10th, when you are into a 10 plus 2, you have to have bio. In the plus 2, there is only biology. There are some Western countries which actually they are taking students from other backgrounds also. When suppose in US and UK and some other countries, they are taking exactly the people having no life science background, they are also taking them. But if I talk of Indian perspective, they usually select those who have bio. And after bio, there is no graduate in public health course till now. There is no BPH. We have MPH courses, We have PG diploma in public health, PG diploma in
So
healthcare management,
MPH is Master in Public Health.
masters in public health, and
Okay.
there are MBA in healthcare management, and there are PG diploma, just like in MBA, similar to MBA. There are PG diploma in healthcare management. There are diploma in public health. DPH is there in some institutes, but all these are up to your graduation. Unlike suppose a MBBS or a BTech degree or BCA or a BBA or a LLB degree, there are graduation courses in specific technical areas. For public health, till now we don't have a graduation level courses. These are all beyond graduation level courses.
Okay.
So after your 10+2, you have to opt for a field which is related to life sciences. It may be medicine. You may be into dentistry. That's like a BDS degree. If you don't get MBBS or BDS, people are opting for BHM, the Bachelor in Homeopathic Medical Sciences, Bachelor in Ayurvedic Medical Sciences. There are BUMS, Bachelor in Unani Medical Sciences. There are yoga graduates right now, and you can have biotechnology. You can be a graduate in biotechnology, in bioinformatics. There are B Pharma courses, Bachelor of Pharmacology courses. Then you have Bachelor of Nursing courses, BSc Nursing courses. So all these guys, even a BSc, one of dairy technology, one of my colleagues, she was having a BSc. She was BTech in dairy technology, both she and her husband. So basically, dairy technology again into life sciences and all. So all these are, there are around 8 to 10 different kinds, maybe more than that, maybe more than even 10 degrees are there, which are related to life sciences, starting from MBS, and if I say from MBBS to the dairy technology or bioinformatics and all. Some bio part is better if you have that. And the problem is that suppose in India, the colleges which are offering a degree in either in MPH or what I said is PG diploma in healthcare management. So these colleges, they usually prefer a person who is having either a BDS degree or a alternate medicine degree like homeopathy, Ayurvedic, and a nursing degree or a pharmacology. So these are these 4-5 are the core areas which they can easily get into admission into a good college. There are plenty of colleges, plenty of universities. They can get a public health degree. They can get a MPH or a master's degree in healthcare management, community healthcare management. But if they want to go into a good college, it's better to have a background which what I just mentioned.
Life science background, right?
These 4-5 degrees, there are exceptions are always there, but these 4-5 things actually it's easier for them to get admission into a good college, because there are not many good colleges in India. I can enumerate few of them if you want to have the information about. Because some medical colleges which had a degree of community medicine that I did, now they have started a school of public health.
Okay.
Just like in PGI Chandigarh, JIPMER in Pondicherry, and AIMS, and there are many good the colleges. There are nationally reputed colleges. They have started a school of public health, and in that school of public health, they are also taking non-MBBS, non-BDS grads, which having life sciences background. They have an entrance examination. You have to go through an entrance examination, and if you qualify, you can get admission. So you are having. They are offering an MPH degree. There is another institute called PHFI, Public Health Foundation of India, which has IAPH. Actually, IAPH was established in the line of IIM and IIT, but somehow it hasn't taken up to that level. But the vision was that we have an institute of that caliber in public health. There are around 6 IAPH across India, Indian Institute of Public Health. And some private colleges are very good, like Sri Chitra Institute in Sri Chitra Tirunal Institute, and Tata Institute of Social Sciences, TIS Mumbai, and IHMR, Indian Institute of Health Management and Research, IHMR Jaipur, IHMR Delhi. So these 7 8 institutes which I am naming right now, these are the institutes of good reputation, and I am seeing the graduates coming from that, because those guys are working for us for the last 10, 12 years, 15 years I have been working. So the guys I am seeing coming for these institutes, they are good. They have sound knowledge and sound experience of all these things. But currently there are plenty of normal universities, like the traditional universities. They are also offering a degree in Master in Public Health or some degree, but because of lack of exposure, actually, so the grads will be coming from those institutes. I am not sure what kind of level they will be having. COVID, and just you said the achievement. If I tell about some of the achievements, there are few notable achievements in public health, and I would not say success, but the way we tackled COVID, that was a lot better than many developed countries. To put it precisely, actually we tackled it much better than many of the so-called developed countries having such robust infrastructure and healthcare system.
Correct.
So actually, people are the current kids are now somehow aware that something is there besides taking medicine and besides just going to a doctor to have a clinical consultation. That is something beyond these things. So I think if we tell them tell these things to current kids, they might get motivated. You say they might get motivated that this is also a viable and a useful career actually, because both things has to be, it has to be viable, and for them it has to be useful for them and for the community. To be honest, I'm happy I have chosen. I'm happy about myself that I have chosen this career path, and to stay. I'm a bit proud of myself also. But on the contrary, there are other things also. I'll put it in different perspectives, because if you say what I was saying just before, some of the major achievements that can actually inspire the kids. First thing is that our parents in their generation, they had smallpox. Our kids might not have heard that, the current kids, but smallpox was a dreaded disease for our parents' generation, and it was eradicated from the entire world in 1978. That was the biggest public health achievement. So you think a disease is eradicated from the world, you cannot find a single patient who will be having smallpox. So that's the achievement of public health system. Then in India, after almost more than a decade of hard work by all the health workers and all the people, India has eradicated polio. Polio, some of the kids, they might have heard the name because of Pulse Polio program and Do Boon Zindagi Ki. They might have heard about polio, but in our generation, you must be, if you remember, in all our classes, there must be 2 or 3 children who are having paralytic polio. But right now, you cannot see if someone says, no, it's a hoax and polio is still there, but you can actually go to school and actually find there is almost no one who is having that kind of disability. So actually, we have eradicated polio from India. It was a huge challenge, and so all these things, they're actually they are the real motivators actually for you. If you think a disease which you have read in your books about 1-2 chapters, and that disease is no longer in the world, so that's the biggest motivation actually. So you work for a public health system, and there is you can actually eradicate a disease, or you cannot eradicate all the diseases, but just I'm giving an example. And next thing are they say the vaccines. They are also a miracle, because diphtheria, but which is the simple diseases, but they are all life-threatening diseases because of vaccines. So those diseases are almost non-existent in majority of the country. And if you talk of suppose the non-communicable diseases, like you may say cancer, you may say diabetes and all, these are also dreaded diseases. We are not yet fully aware of what causes cancer and who can get cancer besides very few ones. There are many of all these diseases. If you once something happens, you can go back, but who will catch that disease? It's still not clear. But definitely there are countries, there are communities who are having a healthy lifestyle, who usually, and those people usually live more than 80-90 years, disease-free life, mentally. So as the definition of health is, you might be aware that health is not merely an absence of disease or infirmity. It is about complete mental, physical, social, and spiritual well-being. And these 4 things are actually very connected actually. So what motivates me is that in public health, you can actually work on all these 4 aspects: your physical, your mental, your emotional, your spiritual, and all these and your social. Because if any 4 or 5 of the factors is in trouble in your life, it will ultimately affect your physical health. So so it's very interesting. And many things happen so that's what keeps me motivating, keeps me inspiring, that what my teacher said, that prevention is always better than cure. they are in the books and everybody knows that, but nobody practices that.
Correct.
So,
Correct.
and on the flip side, Suniti, I would like just a few points, not flip side, but the challenges. Because sometimes you want to do something good, you have the experience, you want to do something good, but in the system doesn't allow you because of their constraints. It can be anything. It can be person driven, it can be a systemic issue, it can be financial issue, it can be HR issue, it can be logistic issue, but you know the solution and you know the pathway. If someone does these things, the result will be very good. But due to all these challenges, sometimes added up, you're not able to do something. So sometimes that's painful, that you want to do something, you have the knowledge and experience to do something, but because of all these challenges, you are not able to. But that can happen in every field. But because it is related to people and their life and their how they live and how they lead a better life, it actually sometimes it gets to you. So you have to be a little more balanced in that. So that's what sometimes is challenging. And because the majority projects, as you said, the majority of the projects are donor driven, either from the
Right.
government, or from big donors like Bill and Melinda Gates Foundation, or from the USAID, or from UNAIDS, or there are some bilateral donors like Japan and Norway. Some countries they donate, and so some certain projects are donor driven. So, and donor driven projects are, they have a timeline, maybe 3 years, maybe 4 years, maybe 5 years. So after a certain time, one project may end, and they may start, they may renew it, they may not renew it. So if you are working for a project which has a lifespan of 3-5 years, so after each 3 and 5 years, there is a transition period where there is a little bit of risk involved and challenge involved. Then you have to jump to, or you have to switch to another organization. And but that happens to current kids. They are anyway switching the organizations
Correct.
almost every alternate. So that's not a problem for them. But you have to be aware about that. What's
Correct.
happening? As you said, India is developing. India is more towards being a developed country, and the modus operandi of taking funds and doing things is actually on the downhill. We are now donating. Now
Correct.
India is acting as a donor to many countries. So
Correct.
maybe in few years, the foreign donations will reduce, and with that,
Right.
but ultimately the government's money will increase, so there will be opportunities in the government sector. Right now, I am
Correct.
working for UN, or somebody is working for another organization. There are plenty of organizations in public health, global
Right.
organizations, national level organizations. There are plenty of organizations, but they are all donor driven. But maybe later on the government will fund them. Who knows? So
Correct.
that might be a paradigm shift. So
Correct.
what I just meant to say is that they must be aware about what's happening around, not just in healthcare, but everywhere in all the political, social perspective, what's happening around. So you have to be on your toes actually sometimes. But it's
Right.
but I would end. It is highly satisfying if you see a village which hasn't got any case of measles or diphtheria or any disease for the last 2, 3, 5 years because of the vaccination program or the child health program. That gives you a lot of happiness when you go into the village and if you are into people, it's really give you happiness. And if you are not into people also, there are scope. If you're into data analytics, if you are good at data, if you are good at monitoring and evaluation, there is a lot of scope, because all the public health persons, they don't always roam in the field. There are also people who are behind the scenes. Their job is equally important. So even if you are not that people person, you don't want to mix with a lot of people, there is also a huge scope in public health.